Bu. Doğru olan bu. Şimdi az önce yanlış bir tane açmışım. Su gene yok. Sıcaklıyorum. Terliyorum. Götümden terler dökülüyor. Hadi. Oh.
Welcome to Surgery Squad's virtual laparoscopic appendectomy.
I'm
Dr. Chuck, and I'll be assisting you with the surgery today. An appendectomy is needed with our patient has already been prepped and is sedated, thanks to our dedicated nursing staff and anesthesiologist. First, we'll insert an endotracheal or breathing tube in the patient's mouth and into her throat to help her breathe
Neydi bu,
during the operation.
laparoskopi miydi? Ha, şuradan sok diyor. Boruyu.
Since I've already taken care of inserting a catheter
Şunu
into her
soktuk
bladder,
bana.
we can move on to more important steps.
Biraz sesini açak.
Thanks to the advancements in medical technology, our patient doesn't have to be cut open to have her appendix removed. Instead, we'll strategically place special surgical instruments, called trocars, through small incisions in her abdomen to perform the surgery. We'll begin by making one small incision in her upper abdomen, one in her lower abdomen, and one in her navel, also known as the belly button.
Oh. Şimdi vallahi ben doktor olamazdım. Onu söyleyeyim de. Çünkü benim yüreğim kaldırmaz böyle şey.
You handled that like a pro.
Evet.
Now we need to pump carbon dioxide gas into the patient's abdomen to obtain a better look at the surgical area.
Boruyu da sok buraya. Sok baba, ha. Ver havayı.
Next, we need to insert our laparoscopic camera through the umbilical trocar. Images from the camera are projected on our monitor to allow us to inspect our patient's abdomen and confirm that the appendix is infected.
Onu söyleyeyim de tek başıma. Televizyon sesi açık biraz. Onlar kıs neredir? Ha.
The inflamed and swollen area you see is the patient's appendix. Our next step is to remove it before it becomes an even greater problem for our patient. The appendicular artery needs to be sealed using a diathermic instrument which uses extreme heat to cauterize the artery.
Hadi.
The artery is then divided using scissors.
Oğlum lanet olsun doktorlar.
So far so good. Keep it up. The appendix now needs to be lassoed with a detachable snare. Take the detachable snare and slide it over the appendix all the way to the base. Repeat this step 2 more times, placing 2 more loops above the first one.
Of. Sıkıştırdım. Bir tane daha. Çat. Ne kadar kolay lan, çat.
Almost there. Now we need to remove the appendix. Use the scissors to snip between the loops. Notice that when you snip, a little pus comes out, indicating that the appendix is infected. Don't worry about it though, we'll clean up everything. To remove the appendix from the abdomen, place it into this specimen bag and pull it out through the trocar. Now onto the cleanup. We've inserted a device that sprays saline into the abdomen. Move it around so that everything gets sprayed clean. With a flick of a switch, our saline is suctioned back into the same device. Finally, we'll remove the trocars and close the incisions with a few surgical staples. Excellent work! The length of the inpatient care and the recovery process following an appendectomy usually varies based on the severity of the appendicitis and the person's age. Luckily, our patient is relatively young and healthy, and we caught her condition early. She should be clear to go home within a day if there are no complications. After being released from the hospital, it is recommended that she limit her physical activity to help the tissues heal faster, but she will need to walk short distances several times a day to speed up the recovery process. She should make a full recovery from her appendectomy within 4 to 6 weeks since her appendix did not rupture. Had it ruptured, a full recovery may have taken up to 8 weeks. And that's an appendectomy. You did amazing. Why not try your surgical.com?
Birazdan geri geliyor. Bu da diğeri. Bakalım bu neymiş? Yüzüme vurdum. Hadi. Yüklendi. Doktor. Bu yıllar anlamını biliyordum da unuttum.
Welcome to Surgery Squad's virtual root canal procedure. I'm the one and only Dr.
Gene mi
Jeff,
sen ya?
and I'll be helping you with this surgery today. A root canal is an endodontic
dişçilik mi
dental
ne bu?
procedure that's used to repair and save a decayed or infected tooth.
Ama sen de.
During a root canal, your dentist or endodontist will remove the pulp tissue
Anladım.
within the tooth. Once everything is removed, they'll clean out any contaminants inside the tooth and seal it to prevent any further infection. Our patient today is having a root canal performed on their lower
Hastayı
right
mı?
second premolar. A dental
Hayır.
professional may refer to this
29
tooth
neyim var?
as tooth 29. Before we begin, would you like to review some of the common myths and misconceptions surrounding root canal treatment?
Ne diyeceğim ki? Ne yapsam ki? Ha. Kanal falan yapalım.
I thought so.
Tabii kanal yapmak lazım.
Not even
Kanal
close. Not true at all. Often patient,
Bu.
not exact.
Yani bol bol
There is
fırçalayın
some-
dişlerinizi hadi.
Let's move on. In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort the needle may cause.
Ne? Şimdi ne yapıyoruz biz?
Next, we can
Uyuşturucu mu? Ne
inject the
yaptık biz
local
ona?
anesthetic. After the local anesthetic has
İğrençlik
taken
ya.
effect,
Vallahi
the
doktorun
area
iğrenç.
should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums. Just below the tooth we'll be performing a root canal treatment on.
Gir baba.
Let's give our patient a few minutes to relax and for their mouth to become completely numb.
Ya arkadaş bir bitmedi ya. 5 dakika sonra. 5 dakika bekle. Bum bum bum çık çık çık bum bum bum.
Now that the patient's mouth is numb, we can move on to isolating the
Sesini
tooth.
açayım da.
Since our patient's saliva
Güzel
contains
sesi gelmez.
contaminants that we don't want getting into the tooth, isolation is a critical step during root canal treatment. To isolate the tooth, we need to punch a small hole into the rubber
yapıyorsunuz
dental
ya?
dam and
İğrenç
place
bu
it
ne?
over the tooth.
Bu ne abi? Ağzına mı sokacağım bunu?
Once the rubber dam is in place, put on a tooth clamp to keep it from
Şut
moving.
mu gösteriyor? Ne gösteriyor?
Next,
Çat.
we'll need to dry out the tooth as much
Beyler
as
doktor
possible
olan
using
yazsın
our
bana.
air water
Söylesin
syringe.
bu böyle böyle diye. Bu ne abi? Kuzen olsaydı bilirdi. Bu ne? Fıs fıs fıs.
So
İki gibi lan
far,
bu
so
ne lan?
good.
Allah belanı versin.
Now that the tooth has been isolated, we can create our access cavity in the
Ah,
tooth using our
Ben de
drill.
dişim ağrıdı. Şimdi. Oydu. Bana
The
bir ara
next
kanal
step is
tedavisi
to
yapalım
clean and
dediler de
shape
ben
the tooth's canal
korktum, yaptırmadım.
using a root canal file. Go ahead and give it a shot.
Abi ben biliyordum böyle pislikler olacağını. İyi ki de yaptırmamışım.
At
Bak
this
dişim
point,
sapasağlam.
the dentist would measure the
Maybe.
depth of the canal
Hayır,
using
ben
a
dişim
combination of x-rays
Hayır.
and specialized equipment. If a dentist fails to measure properly,
Biraz daha
it
kısalım.
could mean that the tooth would be at risk for reinfection. Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
Ne yapıyor? Dolduruyor galiba içini. Evet, doldurdu.
We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the
Doğum şey
tooth
var da
has been
ben
dissolved.
yapmayacağım onu ya. Allah. 5 dakika daha bekleyin.
Great.
Ama
Now
tek
use the
başıma
suction
oynarım
to
ya.
remove the bleach from the patient's tooth.
Doldurdu, boşalttı.
Next, we'll need to fill the
Boşalttı.
tooth using a
Yani dişin
rubber
içini
compound
boşalttı.
known
Pislik
as
yapmayalım
gutta
şimdi.
percha. Gutta percha is often preformed as tiny, thin cones that will insert into
sıcak
the
ya.
clean canal of the
Vallahi.
tooth. I've
Hep hemen
already
ıslak
added
mendili
some
koydum.
sealant to the gutta
Bu
percha
ne?
cone. Let's see what you can do.
Bu,
Looking
iğrenç.
good.
Bu ne?
A heated instrument is now used to remove the excess gutta percha.
Oy.
Pack the gutta
Vay
percha
yavrum.
into the tooth canal using a
Ah,
plugger.
ıslak mendil. tepemde, alnımda ıslak mendil var. Ancak öyle durabiliyorum. Başka çare yok. Ya da gidip soğuk su
After
döküyorum.
the gutta percha has been placed, it is common that additional x-rays are taken to verify that the canal has been adequately sealed off. Once the dentist verifies that
Bu
the
seri
canal
devam
has been
edecek.
sealed, a
Bunu
filling
devam
or
ettireceğim.
crown is placed, depending on the location of the tooth. You can learn more about fillings and crowns in our virtual dental filling and virtual dental crown procedures here on surgerysquad.com.
Ne yapsak ki?
After a root canal,
%95
patients should
falan.
expect some mild
şeyler oldu.
sensitivity and discomfort.
Ya İngilizce sıfır
This
işte
can
anlayın.
usually be relieved using over-the-counter pain medication, such as ibuprofen or
Ha.
naproxen. By brushing
Herkes
twice a
kullanıyor
day,
benziyor.
flossing daily, scheduling regular
İp
dental
kullan,
visits,
dişlerini
and
fırçala
avoiding
ve her
smoking, it is
dönem
possible to
kontrol
greatly
ettir
reduce
diyor.
the need for a root
Doktor
canal.
Jeff öyle dedi.
And that's a root canal. Why not check out some of our
Evet,
other
bugünlük
amazing
bu
surgeries here
Labunik
on
serimizin
surgerysquad.com.
üçüncü mü oluyor? Üçüncü oluyor galiba. 2 mi 3 mü? Neyse artık. Ben onu oraya yazarım. Devam edeceğiz. Güzel oyun. Sevdim. Yani bu kadar. Hadi iyi oyunlar. Oyunsuz kalmayın. Hadi ben gittim.